Hey everyone, welcome back. Today we're going to be talking about healthcare finances. So the first thing we're going to be talking about is government finances versus private finances. So what does that mean? Well, government just means that their finances are funded by tax dollars. So the taxes that we pay as citizens help to cover healthcare expenses for those different facilities and agencies that are ran by the government. This also includes government insurance programs such as Medicare, and Medicare is an insurance program that serves patients over the age of 65, those who receive Social Security disability benefits for at least 2 years, or people that have end-stage renal or kidney disease. And Medicare covers 80% of the charges for that person's care. So this is a really, really good medical health insurance option for older adults. There are different types of Medicare plans. There's Medicare A, B, C, and D. Medicare Part A covers your basic hospital care expenses. Medicare Part B covers outpatient expenses. Medicare Part C is an Advantage plan, which we'll talk about in just a second, and that's an optional plan. And then Medicare Part D is another optional plan that covers specifically medications. Plan A is the original Medicare plan. This is what you're automatically enrolled into unless that patient specifically enrolls into Medicare Part C. So if you are over the age of 65 or you qualify for Medicare following those other requirements listed in the beginning of this presentation, you are automatically enrolled in Plan A. This is a fee-for-service plan, and that means that you have to pay a deductible and a copay, which we'll talk about at the end of this presentation. But that's basically if you come into the doctor, you pay your portion, then they're going to cover the other 80%. With Medicare Plan A, this covers your hospital insurance at no cost to most people. So this means that if you're admitted to the hospital for some type of procedure, then that covers all of your hospital bills. This also covers if you needed skilled nursing care. So if you lived in a skilled nursing facility because you were needing lots of medical attention and you were not able to care for yourself, this Medicare program would also cover those bills. It would also cover critical access hospitals or ICU programs. If you were to go into hospice care, meaning you were terminally ill and had less than 6 months to live, this plan would cover hospice care as well as some home health options too. Now with Medicare Plan B, this pays for the actual necessary medical services and supplies. Most people do pay an extra premium to add Plan B onto their original plan. This covers things like outpatient care, so any type of doctor's visit, vision, dental, any type of doctor service that would be considered outpatient from a medical office. If you were to need physical or occupational therapy, or any additional home health that is not already covered by Plan A. So this is an extra premium that you pay for that covers some more stuff. So for some people, it's worth it to have this plan as well. Medicare Plan C is the combination of Plan A and Plan B. You do have the option to only have Plan B. If you were in pretty good health and you didn't think you were going to be admitted to a hospital anytime soon, you may only opt for Plan B. However, for most people over the age of 65, they do have some type of health problems, and maybe they think they would like to have coverage for Plan A and B, and that's when you would get Plan C. This is provided through some private insurance companies which are approved by Medicare, and you have the option of adding on Plan D to your Plan C. And this includes things like HMOs and PPOs, which we'll talk about in a little while, as well as private fee-for-service plans and Medicare special needs programs. Part B, or Plan D, of the Medicare program is a standalone prescription drug coverage. You have the option to add this to your Medicare program, and most people, again, have to pay a special premium to add this. This plan covers a variety of different drugs, and you can choose the plan that meets your needs based off of what kind of medications you take or how often you're taking them. Medigap is a whole separate program. It's a private individual insurance policy that helps pay for the difference between your charges of care and the amount that Medicare pays. For example, typical Medicare pays only 80%, but say, for example, that you want it to pay more than 80%, you can pay for this Medigap program which maybe that will mean that you only have to pay 10%, Medigap will pay 10%, and Medicare will pay the 80%. So that's less money coming out of your pocket, but you do have to pay for the Medigap insurance. Medicaid is a different type of government health insurance program, and this is provided health care for people who have either really low income, children who qualify for assistance, maybe they're in the foster care, or maybe they've been adopted. So there's lots of different reasons that children might qualify for assistance, or anyone who is disabled or blind may also qualify for Medicaid. Medicaid is also funded by the federal government, but it's regulated by each individual state. So not all people with low income necessarily will qualify. It is up to your state's standards. TRICARE is another type of government health insurance program, and this is for military. This serves anyone who is active duty personnel or their families, as well as survivors of any military personnel or people who have retired from the military. Now with TRICARE, you are limited to the types of facilities that you can go to. Typically, if you have TRICARE insurance, you are only allowed to go to government-approved facilities. Typically, these are things like government-owned hospitals such as the VA or the Veterans Health Administration, and they provide healthcare services to former military personnel. There are limited numbers of VA hospitals, and sometimes they might be really busy, or maybe they have a reputation for not having the best service because they're owned by the government. So those are the things you have to think about with it, whether it's worth it for you to have TRICARE and be limited to which type of hospitals you go to, or have TRICARE and have very, very low cost of healthcare. Now we're moving on to private insurance. So there are different types of private insurance plans, and these are the ones you've probably heard of the most. Private insurance is any type of individual insurance plan that typically the insured person pays the total amount of a monthly premium, and sometimes they might also have a thing called a group insurance plan. And a group insurance plan is when the insured individual and their employer then share the amount of that monthly premium. For example, I am a state employee, being a teacher. All teachers in the state of North Carolina are considered state employees, and we are part of a group insurance plan for state employees. So that means that I pay half of my insurance premium and the state pays half, and that means I now have their health insurance. An HMO, or a health maintenance organization, is a type of private insurance. With HMOs, the care is directed towards prevention of disease, so they really stress going to doctor's appointments annually, getting preventative care, vaccines, and things like that. The patient can only see HMO-approved providers if they are under an HMO plan. And they must also pay a monthly fee, but there is no additional charge for the actual care that they receive. The care from a non-HMO provider is generally not covered, and they would have to pay that out of pocket. So an HMO is really helpful because it typically means that you're going to pay a fee every month, but when you actually go to the doctor, you won't pay anything. However, you can only go to certain HMO doctors, and if you don't, then you're going to pay for all of it out of pocket. Versus a PPO, or a preferred provider organization. A PPO is when you have a group of doctors or hospitals that provide a specific care to a specific group. PPOs provide services to the insured individuals at a reduced rate, and they usually require some type of deductible or copay to be paid up front. This offers less coverage for treatment provided by any non-PPO provider. So the difference is with an HMO, you don't have to pay anything up front, you just pay that monthly fee and you have to go see an HMO provider. With a PPO, there's a whole group of providers that usually work under the same organization, and you do have to go ahead and pay for a deductible or a copay up front, but you are also going to receive services at a reduced rate. My type of health insurance that I am currently under is considered a PPO. An indemnity plan is a traditional plan that comes with more freedom to visit any physician of your choice. You don't have to have a referral required by the insurance company in order to have to be able to go see a certain doctor. However, you do have to pay up front with indemnity plans. You have to pay everything out of pocket. And then later you're going to get reimbursed a certain amount allowed by that insurance policy. And those amounts may vary, so you really never know how much you're going to end up paying or how much you're going to end up getting back. But you do have that freedom to go see whichever doctor you would like. Out of pocket simply just means that you pay in cash, and you don't have health insurance. Now, after the Obamacare laws came out, this wasn't really an option because you had to have insurance or otherwise you were taxed very heavily for not having insurance. I'm not really sure how the laws have changed since the Obama administration left and the Trump administration came into place. But I think that we're starting to see more of a shift where you are required to have health insurance and you're not really allowed to just pay out of pocket because oftentimes people don't have the finances to pay up front for medical care. Another type of health insurance or healthcare finance that we need to look at is workers' compensation. And workers' comp is something that happens and pays for the healthcare of workers whenever they are injured on the job. Now, there are many requirements that you must meet in order to receive workers' comp. You have to have documentation filled out on time. There's usually strict time limits. You have to go to certain approved doctors related to your healthcare organization to get checked out for that injury. And you have to follow up with those doctors. You have to make sure that you go to all of your doctor's visits. And you also have to make sure that whatever you were doing on the job is something you were supposed to be doing and you were trained properly on how to do that. For example, if I went over there and I got a chair and I stood up to fix something on my wall, I have gone to trainings with the city office that says I'm not supposed to stand on chairs. So if I were to stand on that chair and get hurt, I would not be approved for workers' comp because I was doing something I wasn't supposed to be. Now, if I was just walking in my classroom and a light fell out of the ceiling and hit me in the head, then I would probably be approved for workers' comp because that was something out of my control and I wasn't doing anything I wasn't supposed to be. However, the follow-up to that is that I would have to make sure I go report it immediately, that I go to an approved doctor that the school sends me to, and that I do all the paperwork and do what they say in order to get workers' comp. It's a very long process, and it's not something that people should just go, oh, I'm going to get hurt so I can get workers' comp, because a lot of the times you won't end up getting it or you won't get it quickly. Lastly, let's talk about our financial vocabulary. You're going to need to know these words when it comes to doing your health insurance math. So co-insurance is the percentage of the bill for services that the policyholder must pay. So whatever percentage is going to be left over that you as the policyholder is going to have to pay for is your co-insurance. Your co-payment, which is something you're going to hear a lot, is a specific amount that you must pay for a certain medical service, such as maybe you have a co-payment of $15 for each time you go to get a prescription filled or each doctor visit, or maybe you have a $10 co-pay for every time you go to the eye doctor. So a co-pay is just something you're going to have to pay up front every time you go to a certain medical office. And typically on your health insurance card on the back, it will have a list of what those co-payments are. A deductible is the amount that the patient must pay before the insurance actually starts paying for services. For example, you might have a $500 deductible. If you were to go to the doctor and your visit only cost $250, you didn't meet your deductible, which means that your health insurance is not going to cover that. Now, if you were in a car accident and your medical bills were $15,000, you definitely met your deductible at that point, and so now your health insurance is going to kick in. And then that group plan is basically, again, just when your insurer and your employer are working together and you share the amount of the premium. The premium is basically just the cost of your health insurance. So most group plans or most companies you're going to work for probably offer a group plan, especially if you're working in healthcare. That's very common. So that's an important term to know as well. That is everything for health insurance, healthcare finances, and how insurance works. Now you're going to be watching a video of me going through some health insurance math problems with you and guiding you through how to get to your final answers. So go ahead and watch that next and then continue on with your assignments for the day.